Doc Sheena, welcome to the show.
Hi, Zach. We're so honored to have you back here. Welcome again to Sheena Clinic.
Thank you. I'm always happy to be here.
Thank you so much. Alam ko maraming clinics na invite sa'yo, but of course, we're honored to have you.
Thank you. Game na tayo. Sino si Dr. Sheena and what do you do for a living? What's your life's purpose?
Ang hawa ng tanong. Hi, I'm Dr. Sheena. I'm the CEO and Medical Director of Sheena Clinic. I'm a business owner and I'm a thriving but proud mother of 3 beautiful children. So that's basically my life. And my purpose in life, of course, as a doctor, as a mother, and generally as a woman, my purpose in life is to lead with heart, to heal with purpose, and of course, always to rise with grace. That is my whys.
Ang tindi naman ang sagot.
Of course, pang Miss Universe. Meron ba tayong hangover sa Miss Universe?
Sisimula pa lang tayo, pang ending na yung sagot.
Oo nga, no? Sige, pwede naman natin ilagay sa ending yun.
How did you become a dermatologist? Ano yung nag-motivate sa'yo? Pinressure ka ba ng parents kasi doctors din sila? Or is this your own parang passion?
Actually, we're a family of doctors, Zach. My mom and dad are doctors. So lumaki talaga ako ng alam ko lang gawin. My only dream in life is to become a doctor like them. Even though I stumbled early in life, nadapa na maaga, I had my first child when I was 19, 20. So that didn't stop me from pursuing my dream to become a doctor. So always remember na if you have a goal and then you stumble, just reroute. Don't change the goal. You can change the route but don't change the goal. Lagi naman ganon. And I became a dermatologist because for me, it's easier to supervise your children na office hours ka lang, walang on-call, walang emergency. So this aesthetic medicine was really my choice and I think it really suits my lifestyle na I have 3 kids, supervising them, overseeing them. Especially now, I'm a single parent then. So yun.
So ilang years ka ng derma?
Being practicing aesthetic medicine around since 2018. So mga 7 years already.
7 years.
Being a doctor, I graduated 2015, took the boards 2016. So 9 years being a doctor. So mga trainings lang, paulit-ulit na trainings, different trainings. Because in aesthetic medicine kasi, Zach, it's very dynamic. So lagi may bagong products, may bagong techniques. So we always try to challenge ourselves and expose ourselves para marami kaming ma-offer sa mga patients namin. Iba-iba and we always grow then.
Mm-hmm. And how did you start naman your own business, itong Sheena Beauty and Aesthetic Clinic?
Oh, when you start a business, Zach, it's always a leap of faith. And sabi nga nila, it's a calculated risk when you start a business. But you always pray for it. And when windows of opportunities come, you have to grab it. And just learn to trust other people. Trust yourself and trust other people as well. So when opportunity came to me, my best friend, Doc Adi, he offered me the space and then he told me na sasamahan niya ako dito. And that's very important to me na may makasama dito sa business na to. Kasi it's not something, it's very capital intensive din. And hindi ko siya matututukan din. So, kailangan ko talaga na may kasama. So, I think God blessed me with them. God blessed me with opportunities, with the right people. And then I grabbed it. I prayed for it and I grabbed it.
Love that. You prayed for it and then you grabbed it.
Always. Always pray for decisions, big decisions. Diba?
So, 7 years ka na sa practice.
Yes.
Meron bang point in that 7 years na parang you questioned if this is really something you want to do long term?
Actually, Zach, hindi ako that type of person. So, when I make a decision, I really stick with my decision. I'm the type of person, when I stick with my decision, when I make a decision, I do everything to make it work. So, I never questioned that, is this for me? Is this not for me? So, if I chose this path, I will walk this path in the end. So, like sinasabi sa mga anak ko, especially my 17-year-old, no to mediocrity and no to quitting. Always pursue your dreams.
Strong ni mommy?
Yes, of course. Kailangan natin maging strong leader, especially to our children. Kailangan makita nila that Kung ano yung pinipreach mo, you also practice.
What do you think is the secret to your success? Is it, staying informed, education, innovation? Ano yung secret
Well,
mo?
di ko naman masasabing successful na. It's always a step by step. We're always having a room for growth. 'Di ba? So, minsan, yung success sa atin, I mean, that hindi pa success sa akin, success na sa iba. So, for me, always striving to do better. So, my secret to everything is balance. So, I make sure I do everything. May balance ka with family, may work-life balance ka. Yun yung ibig ko sabihin, Zach, na of course, kailangan, ang lagi ko sinasabi, you can't give love or you can't pour to others' cup when your cup is empty. So, I think yun yung parang notion natin ng balance. So, kailangan yung cup mo rin ma-filled before you fill other cups. So, that's the key to having a contented life. Not really a successful life, a contented life.
Wow. Hindi lang pretty si Doc, hindi lang siya magaling. She's also full of wisdom.
Bolero rin si Zach, guys.
Yun yung secret. Skincare myths dito sa Philippines. Number 1,
Okay.
is glutathione really good for your health?
Yes, glutathione is very beneficial to our health, but if used appropriately. Glutathione is made naturally by our body. It's a powerful antioxidant. That's why it's good for liver detoxification, for neutralizing free radicals. So it's good for protecting our overall health, Zach.
Do you think na overhype siya? Kasi wherever you go, magpagluta ka.
I think always with medical supervision and with the right information naman talaga. So me right now, very superficial lang yung sagot ko na yes, it's beneficial. So it's beneficial when used properly. So we have supplementations, we have mga intravenous, mga IV drips. So basta tamang dosage, and if the person needs it, it will really benefit our body.
May bad side effect ba yan kapag nasobrahan ka or you misuse yung paggamit ng glutathione?
Since glutathione is made naturally by our body actually, nagkaroon siya ng effect sa whitening kapag nasasobrahan si glutathione. Kaya siya, actually, it was found out that glutathione whitens or it clears the skin because of cancer patients. Cancer patients kasi they undergo chemotherapy. After that, they are given glutathione therapy para ma-detoxify yung liver nila. So, nalaman nila na after the glutathione therapy, pumuputi yung mga patients. So, dun lang siya nagkaroon ng seat sa aesthetic world nung nalaman nila na meron siyang whitening or clearing, nakaka-clear siya ng skin natin because of that. So, I don't think naman na nasusobrahan siya. Well, generally in life, na masama pag sobra, di ba? So, basta na tamang dosage of our body, saka na-detoxify naman siya ng kidney natin. So, tamang dosage lang and tamang supervision, it's really beneficial and we really need it. Everybody needs glutathione.
Alright, next myth. Is it okay to skip sunscreen on a cloudy day?
Of course not. It's not okay to skip sunscreen. Everybody knows may non-negotiable skincare is sunscreen, guys. So, kahit walang araw, even if it's cloudy, even if you stay indoors, you should wear your sunscreen. Kasi kahit cloudy, 80% of UV rays still penetrate the clouds. Even if you're inside, indoors, especially many of us are always on screen, the screen emits blue light and it can also cause aging, it can also damage your skin, and can cause pigmentation.
Mm-hmm. So, sunscreen only on your face, on your arms, saan dapat siya nilalagay?
Generally speaking, face is okay. Pero syempre, kailangan all of our body is protected kasi lahat naman talaga naapektuhan ng UVA rays talaga.
Right.
Do you wear sunscreen, Zach? Oh no. Patay tayo dyan.
I live in Australia na mataas daw yung UV.
Yes, exactly.
But matigas yung ulo ko minsan.
Ayun lang. Yun lang. Bawal ang matigas ang ulo kasi pagsisisihan mo sa huli.
So kahit work from home ako, pagkagising ko ng umaga, straight to work in my home office, I need to wear sunscreen.
And you're always on screen, Zach. Di ba, as I've said, screen emits blue light.
Yeah.
And it can also cause uneven skin tones, pigmentations. Kailangan at least SPF 50. Because SPF 50 blocks 99% of UVA and UVB rays.
Get
So
it.
non-negotiable yan.
Alright,
Sunscreen.
so non-negotiable ni Doc Sheena, sunscreen.
Yep.
Next myth, can you skip moisturizer if you have oily skin?
Laging tanong yan sa akin ng mga patients ko, Zach. Doc, oily na ako, magmo-moisturizer pa ako. Of course, you still need to put moisturizer. Because if our skin loses hydration, loses moisture, nagko-compensate siya by producing more oil. So, it always compensates to equality. So, ibig sabihin nun, the lesser moisture you have, the lesser hydrated you are, the more it produces oil. So even oily skin needs balance, not deprivation.
Right.
Ang
Great.
key lang dyan, of course, is we use a lightweight, non-comedogenic. Ibig sabihin ng non-comedogenic, it doesn't clog pores. So lightweight, non-comedogenic moisturizers are very, very important. It should be our BFF as well.
The more expensive the product, the better it works. Do you agree?
I don't agree with that, actually. I'm not a fan of very, very expensive products. You know why? Usually, some products, they charge more dahil sa luxury packaging, dahil sa branding, because some celebrity endorses them. That's why tumataas yung value niya. Of course, meron din namang mga expensive products that their ingredients is backed up by science, so they have expensive ingredients, but not necessarily, hindi ibig sabihin mahal, maganda. So what's important is the formulation, the active ingredients, and what really suits your skin's need. So yun yung important. So you can mix it kahit mga affordable. They have, backed up, science-backed up ingredients naman that also effective, if not better.
How important to go to your doctor first, your derma, to get assessed before you buy many products, expensive products for your skincare?
Alam mo, Zach, dyan nagsimula sa Sheena's Choice. I started it in 2020. Ibig sabihin ng Sheena's Choice is, patients can ask me, ano yung skincare na right for them? Personalized skincare. Kasi yung marami dyan, they have a lot of skincare. Magaganda naman sila, but they don't use it right. Hindi nila alam kung paano gamitin, hindi nila alam paano i-mix, hindi nila alam paano i-layer. So, I think they should consult an expert first on what kinds of products that should be used and how to use them as well. But alam ko naman marami nang sa Google, in internet, marami na silang nakikita. It's also important that, they seek advice from those who have experienced a lot of this na.
Next, last one, a myth. Facials and skin treatments are only for women.
What do you think? What do you think, Zach? Ikaw ang tatanungin ko.
Ako, I don't think so.
Yeah.
Yeah. Well, I grew up kasi watching my dad, my lolo. They never went to dermatologist. For them, it's just, soap water.
And they survive with it.
They survived life naman. They did well. But parang iba na ngayon eh. I would say my 10 guy friends, maybe at least 5 of them have some sort of skincare routine.
Diba? So, ako, marami pang room for growth ng skincare for men. Kailangan lang natin matanggal yung notion na, if they do skincare, they're vain na. Skincare for men is not vanity. It's actually for hygiene, for health, and for confidence. Diba? That's skin health. And regardless gender, skincare, treatments, facial is for everyone. All of us, our skin needs hydration, protection, cleansing. Wala namang pinagkaiba yan. Actually, mas magbe-benefit ang men. Kasi they produce more oil, they have lots of hair na pwedeng ma-clog yung pores mo or magkaroon ng ingrown hairs. You're more exposed to the sun, di ba? So, mas beneficial actually for men that they go seek professional help for their skin. Dapat lang talaga matanggal na parang if they go to the derma or if they go to aesthetic clinics na parang it reduces their masculinity. It's not actually. So we need to feel good. We need to feel confident about ourselves. And it starts with self-love and doing these things, di ba?
All right, let's talk about acne and acne scarring. Personally, I experienced this. I struggled with this growing up. And first topic, how to manage hormonal acne.
Okay, so Zach, there are a lot of types of acne out there. So hormonal acne, makikita mo yan based sa distribution ng acne sa face. So usually it's in the lower parts of the face, sa chin, sa jaw, in the lower parts of the cheek. So when you see that, may guess ka na it's hormonal acne. So you have to know the cause first. So you have to ask the patient, regular ba ang menses niya, and then so forth and so on. Hormonal acne is caused by super taas ng androgen level natin. So androgen level is a hormone of men. That's why men are more oily. Kasi they have more levels of androgen, of testosterone. Testosterone or the androgens in our body, sila yung nagpo-produce ng more oil. So we have to control that kasi if sobrang production ng oil, yun yung nagkakause din ng clogging of pores. That's why yun yung itinatarget ng mga acne medications natin for hormonal acne. So what are the medications? Usually, I give my patients oral contraceptives to balance the hormones. I also give spironolactone. Spironolactone is used to decrease androgen level. Or pag resistant na yung cases or very severe na yung acne like cystic or nodular, I sometimes advise to give oral isotretinoin. So this one also addressed our sebaceous gland to reduce the production of oil. I don't know what medications have you tried for yourself?
Whatever you gave me.
Did I give you oral isotretinoin? Kasi hindi na kita
Yeah.
naabutan
You did.
Okay.
Yeah. Naubos ko na yata siya.
Yeah. It's not without side effects though. So oral isotretinoin makes your skin dry naman kasi nga it reduces oil production.
Right.
So
Okay.
remember, I don't know if you remembered na parang nag-dry yung lips mo, naging dry yung skin mo. So proper education to patients is very important when giving them these medications. And I think managing hormonal acne, the key is to be patient with it. Kasi a lot of us are not patient anymore. So parang feeling natin, if we use this skincare, if we use this medication, after 1 month wala pa ring effect, parang we don't feel like doing it again or continuing our medication, di ba? At least 8 to 12 weeks, let's be religious and let's stick with our plan before we assess na it's not right for us. Patience is a key. Patience is a talent. Do you agree?
Yeah, but I'm impatient.
Oh, really?
Yeah.
You know, patience can bring you to places.
Yeah. I agree, but
But
I struggle.
meron pa siya. At least you're aware.
Yeah.
You start with
aware.
that, na you're not patient.
People around me are aware as well.
Ah, talaga?
Kasi I want fast results. I want to move fast.
Okay.
So, nagagamit ko naman yung pagiging impatient ko in a good way. Meaning
Like what?
finding better systems.
Okay.
I just don't like delays.
You don't like delays? Of course, nobody likes delays.
Kasi, let's say you said to me na, Zach, you'll see results in, kunyari, 3 months.
Yeah.
I will expect 3 months.
Yeah.
Pagka 3-4 months wala pa, parang for me, that's delay. Is there something wrong?
So I think very important also to set expectations with you.
Yeah.
Okay. So, it's not actually, so kailangan then clear, di ba, black and white na kailangan clear lang din to set expectations para hindi mo maisip na it's a delay and you don't become impatient.
Yeah.
Well, generally, men are impatient. Do you agree?
No comment. Next one. Common mistakes when treating pimples.
Well,
Yung pinuputok.
see? So, yun. Sinabi niya na yung pinuputok, that's super bad practice, Zach. Kasi you know why? When you try to prick them up, meron something inside na parang pinupush mo pa inside. So, you push it deeper and you causes more inflammation and damage to the tissues around it. So, hindi siya nakakabuti actually, nakakasama pa siya if you do self-treat yourself. Common mistake also is, applying toothpaste or mga over-the-counter, kasi it can harm the normal tissues around eh. So, it's not also nice na magsa-self-treat tayo or self-diagnose tayo when treating our acne. Ano po ba yung mga ginagawa mo that you think it's...
Before nga kasi, yung mga, di ba, guy friends, putukin mo, or pag mahirap putukin, lagyan mo ng warm cloth para lumambot, tsaka mo siya putukin.
Okay.
So, when I was growing up, kala ko, that's the norm. So, I did that kasi nga impatient, di ba?
Yeah, exactly. So, going back to being impatient, may normal cycle kasi yung acne. So, if you become impatient, mas lalong tatagal yan. So, you have to be patient na pabilisin mo lang, hayaan mo lang yan, lalabas din yan. Kasi if you try to prick it again, mas lalalim pa siya. So, mas matagal lalo siya lalabas and to heal itself.
Ang embarrassing kasi, di ba, pasok ng school, high school or college, makita mo yung crush mo,
Uh-huh.
tapos may pimple ka.
Buti nga ngayon may pimple patch na eh.
Oh yeah, yung
Yeah.
parang band-aid na
That's why
ewan.
I tell my patients na if nararamdaman mo na merong bumps, you have to treat them na, spot treat it na with something, with a medication, with a ointment or a cream para mas mabilis siya mahinog and mas mabilis mag-heal. So yun naman din yung advice ko na wag na nalang hintayin maging parang super pus-like na yung acne nila before they treat it. Para hindi embarrassing.
Alright, next. What is the best way to treat acne scars? Is it microneedling, laser, or topicals?
Acne scars are very, very difficult to treat. Like you have them, diba? You're suffering from them. I always tell my patients it's multimodalities. So we have to treat the upper parts, the super layers, superficial part ng skin. We have to treat the middle and the deep parts of the skin natin. So, multimodality is the key. So, microneedling, it's nice kasi it treats a superficial layer of the skin. So, it stimulates more collagen. So, we also need to use something, a biostimulator. So, that one naman stimulates collagen on the deeper parts of the skin. So, laser also promotes texture. It also improves the texture of your skin. So, lasers are also nice in treating. So, generally speaking, when treating acne scars, multimodality is the key.
When is the best time to see a dermatologist for acne?
Anytime naman, you can seek professional help when you're suffering from acne, especially if you don't know what to do. Of course, some teenagers, men, usually they don't know what's the first step to do when they have acne. So anytime that you have acne, you can seek professional help. But if you think like, if you tried a lot of ways already to treat your acne, it's not working, that's the time you seek professional help na. For example, mas lalong kumakalat na siya, lumalaki, and it's causing discomfort for you. It's embarrassing for you, nawawala na yung self-esteem and confidence mo. Yun naman ang role namin, to bring back self-esteem and self-confidence.
So would you say na it's best to visit a derma kapag ka nagsisimula pa lang
Yes.
than pag grabe na siya?
Always remember, prevention is better than treatment. So, ako as a doctor, kilala ko ng mga patients ko, I make sure I educate them, I empower them. Kasi ayoko naman na lagi sila magtatanong sa akin, lagi sila mangungulit sa akin. So, I educate them on how to prevent, formation of acne and how to treat them kahit hindi sila bumalik sa akin. So, I empower them as well. So, ayoko naman maging selfish na kailangan pumunta pa sila sa akin every time. So, anytime, kailangan mag-seek na sila professional help, and we're here to help you guys, enlighten you, educate you, and empower you in treating your skin problems.
Let's talk about anti-aging and aesthetics naman. So what age should you start anti-aging skincare?
When it comes to age, starting at the age of 25, guys, we lose our collagen at a rate of 1% per year. So for example, you're 32.
Two.
So 7% of your collagen has been lost already. So depende pa yan if you're more exposed to stress, if you're more exposed to pollution or mga bisyo. So mas mabilis ma-degrade yung collagen mo. So it depends on the lifestyle. So kailangan at the age of as early as 25, we can use anti-aging treatments and skincare na rin.
Yung mga Botox, fillers, and threads, what's the difference and when should you consider them?
Actually, iba-iba yan, Zach. So, Botox, fillers, and threads, they address different skin problems. They address different concerns. So, Botox, just to be fast, when you see dynamic lines or lines na sa skin mo, you're a candidate for Botox. For fillers, if you want to enhance volume, you use fillers. For example, you have hollow under eye, you want to augment your chin or your jaw and your cheeks, you can use fillers. Threads naman, it's usually used for rejuvenation and for lifting, mechanical lifting. So, for example, you have deep nasolabial folds, you can use threads to lift that tissue. So, iba-iba siya ng gamit. So, it's very important that you seek professional help first before deciding what to use and what to do.
Ano naman yung mga natural ways to keep skin youthful? Nakaka-apekto ba yung sleep, yung food, hydration, stress?
Definitely. Anything that happens inside our body reflects on our skin. So, I always tell my patients, hydrate, hydrate, hydrate. So, hindi lang ang moisturizer makakatulong sa hydration ng skin. You have to be hydrated also. So, water, mga antioxidant, mga detox water natin. I don't know if you've tried mga lemon water. So, that's very important as well. And sleep is very apparent for someone. Makikita mo talaga na wala siyang tulog. Ako, alam na alam ko, especially sa eyes. When you lack sleep, dehydrated ka, your skin looks dull, and you have dark under eyes or malalim yung under eye area mo. So overall health, it reflects on our skin. So that's why we have to take care of our health if we want our skin to look good and better.
Yung glassy-looking skin, mga nakikita ko sa influencers, artista, is it really achievable or parang mga filters, Instagram filters lang yan?
Ako, Zach, I swear, we don't use filters here in our clinic, especially sa mga pub mats namin. So, it's a big no-no for us. So, when you say na totoo ba yun, yeah, it's real and it's achievable to have a glass skin. A lot of my patients come to me, Doc, I want a glass skin. I know now what to do. So, it's achievable. Do you want to have? We can start our journey there as well. So, kung ayaw mo maniwala.
Yeah, magmumukha ba akong si Edward Cullen, yung
O, iba naman yun.
Iba ba yan? Shiny.
like diamond skin naman ang tawag doon, no? Diba?
Yeah, ibang treatment yun.
Gusto mo maging vampira?
Pwede din. Para kasi mayayaman silang vampires.
Edward Cullen. Yun pala ang goal ni Zach, guys.
Edward Cullen.
Yung diamond skin.
Yep. Okay, let's talk about treatments and technology. What are the top 3 requested skin treatments in Manila and why people love them?
Well, I cannot speak for whole Manila itself. Siguro I'll speak for the clinic na lang, diba? So, as we talk about glass skin, a lot of my patients are asking for it. Usually kasi, Zach, they come to me for concerns, not for the treatments. For example, glass skin ang concern nila. So, microneedling is one of the top choices for here in our clinic for glass skin. Lasers, and of course, the injectables like Botox. So, yun yung mga top 3 treatments that we do here in the clinic. And usually, patients come because they want a glass skin, they want smoother skin, they want flawless skin. So, yun yung mga binibigay naming options for them. So, yun, Botox, lasers, and microneedling.
With your clients dito sa clinic, generally, what do they do for a living? Are there influencers, everyday people, employees? Ano yung demographic nila?
Here sa Sheena Clinic, very diverse din. So usually, mothers na parang they're trying to give back to themselves na women who practices self-love, self-care, and of course, meron na rin silang mga nasasama ng mga boyfriend nila or husband nila, nakakasama na rin natin dito. The youngsters naman, usually sinasama sila ng parents nila. Usually, the parents are more concerned. So, sila yung mga dinadala nila. But, generally, the demographics, mostly women pa rin. So, we need to improve on our men market. Generally, women na marami pang oras. Okay? So, usually, mga negosyante nga, hawak nilang sarili nilang oras. But for those who are going in the office naman, usually we carry them, we welcome them naman sa gabi. Kasi hanggang 8 p.m. naman ang clinic.
Are facials worth it or just a hype?
What do you mean a hype?
Parang nauuso lang ba siya kasi everyone's doing it, influencers, content creators na...
Facials. Well, facials are very essential. They're very basic treatment. Ibig sabihin lang ng facial, Zach, is we want to clean our face deeply. Kailangan hindi nagagawa ng normal cleansing. So, we clean our pores, we unclog our pores, we do extra treatments like mask, LED light therapy, so things that we don't do in our household. So, it's a basic necessity. It's not a hype. So, isa yun sa mga sinasabi ko sa mga patients who just want, to maintain their skin. Regular facial, at least every 6 to 8 weeks is okay. As long as they have a good skincare then. Kasi I always tell them naman na, we can only do as much here in the clinic. So, kasi di ba minsan, going here without skincare, it's like going to the gym without dieting, right? So, kailangan, if you go here, meron ka ring regular skincare. If you don't like regular facials, then. Kasi may mga skincare naman that could, do the works of like going in a facial then naman.
Paano nakakatulong yung having a good skin and skincare routine could help you with your confidence?
I think right now, people are always, can see a lot of people in social media, diba? So parang they always compare na ang ganda naman ng skin nito, ang ganda naman ng skin nito. So nagkakaroon ng standard, Jack. So parang everybody wants to look good in and off cam. So I think having a good skin is not vanity, as I've said, it's not vanity. It's like for hygiene, for health, and for our confidence then as well. So kailangan, totoo yung sinasabi nilang face card. You have to look good in order for people to trust you. Diba? Minsan, may isang tao pala makikita pa lang natin na parang hindi yata ito bukang pagkakatiwalaan. Tama o hindi?
True.
Oh, that's
Yeah.
true. So that's why I tell my patients, we have to invest on how we look.
Yeah. Yeah.
Because how we look also makes us, it shows on, lalabas yung confidence natin and how we deal with them as well.
So people judge you before you even open your mouth.
That's true. We have to face reality. Hindi naman tayo judgmental, di ba? Pero, even before you open your mouth, parang, ikaw ba, you wanna deal with someone na parang, hindi mo na, doesn't look pleasant to you. So, it's important, kumbaga, meron ka advantage
Yep.
if you look good or you feel good. Kasi some naman, they don't really look like, Korean or handsome looking, pero they feel good about themselves and that radiates confidence.
Next. Skincare for men. Is it any different from women's? May pagkakaiba ba yung skincare routine for men and women?
As I've said a while ago, so wala siyang difference sa gender. Siguro minsan may mga packaging lang na sinasabi na this is for men. Siguro they focus more on, adding more active ingredients that would address oiliness. Kasi nga, di ba, tend to have to produce more oil. So usually may mga differences lang, may mga small difference lang sa active ingredients, but they're generally all the same lang. Kung anong ginagamit ng babae, pwede rin gamitin ng lalaki, and vice versa.
Are laser treatments, is it safe for morena, yung medium to dark skin?
Okay. Laser. When we talk about laser, that's very tricky. Pag sinabing laser, it involves different wavelengths. So I don't want to deal with that scientific na. It's generally safe for everyone. But usually, it can cause more side effects for darker skin types. Kasi yung melanin natin, which is mas marami sa mga morena and darker skin types, they absorb more power. They absorb more laser, kumbaga. So, mas maraming chance na magkaroon ng side effects sa mga morena and darker skin tone patients. So, kailangan lang cautious. Hindi naman ibig sabihin bawal sila. Medyo kailangan lang cautious tayo, mas careful tayo sa mga settings ng laser. But we're all candidates for laser then.
All right, next is, let's talk about skincare for men. Ito, I'm
Okay.
excited about this. Kasi I didn't have the luxury of skincare when I was growing up. Kasi I'm just focused on school, playing basketball,
So, anong
playing
ginagamit
video
mo sa face mo?
When I
Before?
was in high school, college, ano lang, soap and water
What soap?
and prayers.
Soap?
Yun lang.
Safeguard?
Safeguard.
Oh, see?
Tapos yung medyo kumita na Dove na. Ganun.
Oh, Dove na.
So, minsan olay pag may extra budget. So, kasi yung nakikita ko sa TV eh.
Oo. So, yun yung sa'yo, influence ng TV.
Yeah. So, do men really need skincare? Or is soap and water enough?
Of course not. You should know the answer. Soap and water is not enough. Especially soap. Especially bar soap. It makes your skin very, very dry. So, hindi na uso na ginagamit yung safeguard or bar soap sa face kasi it makes your skin dry. And when your skin is dry, it's more prone to irritation, it's more prone to infection, and it's more prone to aging. So, number one, no bar soap. So, very important ako, basic lang. If starter yung men sa skincare, sasabihin ko lang, you just have to have a soap or a cleanser, sorry, not a bar soap. You should have a cleanser, a toner, and a sunscreen. If they want 3. So, and then we start to elevate. So, pag kunyari nakikita na results, let's add this. Let's add vitamin C. And then, mamaya, mga after few months, oh, let's add moisturizer. The next time, late na sila sa work nila.
Kasi ang dami ng routine.
Yeah, that's what happens. That's what happened to my partner. Parang nung una sunscreen lang, and then mamaya naglagay ako sa ano niya ng cleanser, and then mamaya naglagay ako sa ano ng vitamin C. Ano ba to? Ba't dumadami na to? But you know, when people appreciate the effect of it, like a lot of people tell him na, bakit parang glass skin mo na? So mas napupush siya to use the skincare kasi you know, men are results-driven like you. You
Yeah.
told me a while ago, you're results-driven. So, kailangan ma-feel muna nila, makita muna ng results before they believe. So, kailangan mag-start muna tayo sa, ayoko muna silang ipasubo sa 10-step, 5-step. I make sure I ask my patients, ano yung kaya mo i-comply? I start from there. And then, at least man lang doon, religiously nila magamit, then they see the effect. Doon na sila lalapit sa'yo na, Doc, what can we add more? This is my goal. Ayan.
Skincare routine for guys who hit the gym or work outdoors.
Well, when you say outdoors, definitely they should have sunscreen. And when they work out, ibig sabihin lang yan, they have to change their clothes right away. Hindi pwedeng mapawisan and then matuyo yung pawis nila doon. So, yun lang yung mga habits na kailangan nating i-point out. For example, you're working out, you have to change right away. Kasi yun yung mga nagka-cause ng back acne, chest acne, if hindi sila nagpalit. So, it's more of hygiene, Zach. So, always remember, pag cleansing, always, yung skincare naman is very basic. Cleansing, hydrating, and protecting. So, dun papasok yung cleanser natin, and then we have our toner, our moisturizer, and then for protection, sunscreen. That's very, very basic to begin with. It doesn't matter kung nag-workout ka or going outdoors. May mga certain skincare lang or may mga certain products lang na it's more appropriate outdoors, it's more appropriate for those who goes to the gym. For example, for those who goes to the gym, kailangan yung water resistant para hindi mawala agad yung skincare nila. So, pwede rin yung lightweight kasi nga magpapawisan sila so they don't wanna feel very sticky. So, yun naman yung mga, dun papasok yung mga texture ng mga products natin.
For those lazy guys, yung mga minimalist like me.
Minimalist.
Yeah. We'll call it minimalist. Let's not call them lazy. Ano yung best na 3-step skincare routine? What's the bare minimum I can do to look after my skin?
So for minimalist, as I've said a while ago, cleanser of course. So not just an ordinary cleanser that is suitable for their skin type. Kasi meron mga cleanser, Zach, na milky, may mga cleanser na gel-like. So for dry skin, kailangan yung mga milky or creamy cleansers. For mga oily skin, kailangan yung mga gel-type cleansers. So different pa yan. So cleanser is very important kasi that's part of the basic, diba, cleansing. And then sometimes we do toner or a serum or a moisturizer. Mamili sila. For example, my patient is oily. I would suggest add toner pa. Kasi toner balances the skin's pH. It removes excess oil and excess dirt. And makakatulong pa siya sa cleansing ng pores natin. And last, of course, as I've said, for protection, sunscreen.
Yep.
Sunscreen is very important. Sunscreen is not just an armor. Sunscreen is an armor of every day. Hindi siya a weather-based accessory.
So face wash, toner, moisturizer, sunscreen, which one do you really need?
So paulit-ulit ako, lagi ko sinasabi, sunscreen is my non-negotiable. Alam mo bakit? UV damage causes almost all skincare problems. Lines, wrinkles, pigmentation, oil production as well. So lahat yan halos talaga ang nagkakos is our UVA rays, UV damage. That's why papipiliin mo ako doon kung isa lang, sunscreen talaga.
Alright, let's talk about skincare for men, yung grooming and image naman.
Okay.
So, is skincare unmanly? Nakakabawas ba ng pagkalalaki, ng pagiging masculine if you're looking after your skin?
What do you think? Kasi I'm a woman Zach. What do you think? Ikaw, pag nag-skincare ka ba, do you hide it from your friends?
No, hindi. Dati may stigma na ganun eh. Ba't natawag ko na, bading yan. Or girly yan. Nung, syempre, when I was in a high school, college. But now I understand na, your skin is the biggest part of your body.
It's the biggest organ.
So if you don't look after it, ikaw din yung
Exactly.
mag-sacrifice.
And it's like a mirror of what's going on inside our body. So whatever that's happening inside, it reflects on our skin. So regardless of our gender, men or women, kailangan pangalagaan natin yung skin natin. So having a skincare, it's not reducing your masculinity. Actually, for me, I appreciate them more kasi ibig sabihin nun, mas inaalagaan nila yung sarili nila. So for me, confidence is very important as one of the things I look for in men. Kailangan they're confident, they're secure of themselves. And how do they start that? Of course, by, looking good, feeling great about themselves. Skincare, having a skincare is just basic step for feeling good about themselves.
What if si boyfriend may 10-step skincare routine? Tapos si girl, si GF, 3 steps lang. Red flag ba yun? Mas vain.
Alam mo, you would be surprised. Mas vain talaga ang lalaki if they start, doing skincare. Kasi sabi ko nga, they're results driven. So, when they see results, doon na sila paad ng paad. Paad ng paad. As in, you would be surprised, mas concerned sila talaga on how, I have a patient who's like that. Mas maraming skincare si husband kaysa kay wife. Kasi mas vain, I don't wanna say the word vain mas na-appreciate niya yung results of having more. Si wife naman, mas sensitive kasi yung skin. So that's why she sticks with a little lang.
Yep.
So depende rin naman. So hindi ko naman pwedeng sabihin red flag yon. Kung 3 lang ako and then 10 sa kanya. May other pa tayong pwedeng tignan, Zach, na red flag for men. Hindi lang naman yung number of skincare nila.
Yep. So, depende sa needs ng both
Depende sa needs pa
individual.
rin. Depende sa needs.
Okay. How healthy skin boosts confidence and even career opportunities?
Di ba pinag-usapan natin a while ago yung face card, right? So, skin health, yan ang unang tinitignan. For example, when you're doing a job interview, of course, how you look is very important as well. Hindi lang yung pinag-aralan mo, hindi lang yung work experience mo. Of course, especially for example in our industry, I tell when we do job interviews, of course, I look at them. Hindi naman sa gina-judge ko sila, but because we're in a beauty industry, so
Yep.
we have to walk the talk. For example, me, I cannot, hindi ako pwede magpabaya sa sarili ko because I have to practice what I preach. Diba? How can my patients trust me if nakita nila na ako, hindi ko kayang alagaan yung sarili ko? So that's very important, skin health, how you look, how you feel, in boosting your self-confidence. And I think, Zach, when you're confident enough, I think there are a lot of opportunities that will come. And I think when you're confident enough, mas courageous ka to, pursue different types of opportunities, diba? So, start with self-care and self-love.
Yeah.
To
Sabi
boost
nila,
confidence.
if you look good, you feel good, and you do good.
Exactly. Yun siguro yung minsan sa field namin, hindi na-appreciate. Kasi parang of course, people will say na pag doctor ka, you save lives.
Yeah.
But they don't realize we save lives as well. A lot of my patients undergo a lot of mental problems, heartbreak, psychological problems. So, us being here, helping them to feel good, to look good, little do we know, di ba, nakakatulong na rin tayo sa kanila sa pag-gain back ng self-esteem nila.
Best treatments for visible pores, dark spots, and uneven tone, especially for morenas and brown skin.
So as I've said a while ago, for morena and dark skin, medyo cautious tayo when using lasers kasi they absorb, the melanin absorbs more power. So for that, I usually do microneedling. So we have lots of microneedling treatment here, and it addresses pores kasi it stimulates collagen on a superficial level. It also addresses the pigmentation. So very, very diverse ang effect ng microneedling natin. So for morena, I think that's the treatment that I would suggest aside from having a good skincare na rin.
Pangmayaman lang daw yung mga facial treatment, yung mga skincare routine. Do you agree?
I don't agree at all. Skincare treatments, facial, and it's for everyone. everyone deserves to feel confident about themselves. Everybody deserves to be beautiful. Everybody deserves to look good. It's just a matter of, for example, our clinic, iba ang target market. Other clinics, iba ang target market. So, it's finding the right clinic and the right doctor that would make you feel good and look good. So, hindi lang siya pang mayaman, hindi lang siya pang may pera. Kailangan maalis yung notion na yun na, it's a luxury. It should be a basic need already.
Dun naman sa yung mga budgetarian,
Yeah.
mga people who are on a budget, they cannot afford yung medyo pricey treatments. What would you recommend na for them to start to look after their skin?
Actually, Zach, I give them options. It's very important that I give them options. I tell also my sales team then na don't make them feel coerced to get this, to buy this. I make sure give them option. Hindi porket mababa ang budget, hindi na maganda yung results na pwedeng gawin sa'yo. Even if they don't have budget for treatments, sasabihin ko sa kanila, just have a good skincare regimen. Ma-appreciate mo na yan. Would you believe ako, I seldom go here and makahiga sa bed to do treatments.
Yeah.
I am just religious with my skincare regimen. And when I suggest skincare regimen, I ask my patients, ano talaga yung budget nila? So, para mas makapagbigay din ako ng other suggestion na mga products para pasok din sa budget nila. So, hindi totoo yun. Everybody deserves to have a good skin.
Let's talk about Botox.
Botox.
Yeah. Why more men are getting Botox now? Tama ba? Botox? How do you say it?
Actually, Botox is a brand.
Okay.
It just so happened na siya nauna sa market. So, ginamit na talaga siya. So, Botox is a US brand. So, I always call it a toxin kasi that's the general term for it.
Toxin.
But yeah, it's a toxin. Botox is a toxin. It comes from a bacteria. It paralyzes the muscle. So, why men are getting it? Kasi it makes them look fresher. So, for example, di ba sinadjust ko sa'yo, let's do Botox kasi you have lines already sa forehead. Those are called dynamic lines. Ibig sabihin nun, these are the lines that we see when moving upon animation. Mahirap na kasi i-treat pag nakikita mo na yung line even without movement. So, toxin, it's best for those people with dynamic lines. Makakatulong siya for static lines na. Ibig sabihin ng static lines, yung hindi na natin, yung may line na siya even without movement. Pero because of Botox usually, gumaganda yung itsura, nagiging smoother, nagiging glass skin yung face. Yung skin natin. You should try it also.
Later.
Let's do it later, guys.
See, after the podcast. Kailangan ba ng mga lalaki ang sunscreen? Is it important?
Yes, definitely. Everybody needs sunscreen. It's a matter of what type of sunscreen or ano yung texture ng sunscreen. So a lot of my patients, they like lightweight lang. So that's very important para mag-comply sila.
Yeah.
Especially men, kasi they don't like to look like they're wearing sunscreen because of the stigma. But we have here a lot of products already are lightweight, velvet matte finish na they would comply with it.
Ito naman, how do you keep your skin from aging faster than you do?
A lot, Zach. Actually, natural ways is, get more sleep, eat healthy, exercise, and diet.
Sa sleep pa lang bagsak na ako.
Yes. Ilang oras ka ba natutulog? Every night?
I'm good with 4 to 5.
Really?
Yeah.
You need help.
Bitin?
Bitin yon. 4 to 5 is not enough. Why? Do you have active minds all the time?
Yeah, I'm a night owl. Tapos I wake up early. But I feel more comfortable 5 hours. Pag na 6, 7, I feel more groggy
sluggish.
na. Yeah.
It, feeling mo lang yon. Pero babawi yun sa'yo later on in life.
Right.
So, of course, as I've said, diba, family of doctors kami. So, my other relatives would tell me, babawiin yan ng katawan mo when you grow old. So, when we don't have sleep, our cortisol level shoots up. Cortisol is our stress hormone. So, pag nag-shoot up yung cortisol natin, dun nalalabas lahat ng sakit. Hindi lang sa skin, pati sa kidney, pati sa heart, may magiging domino effect na yan. So, we want to keep our cortisol low by getting enough sleep. Not more sleep, enough sleep for our age.
Ano naman yung best suggestion mo for skincare treatments for men and women in their 20s?
20s. So usually for 20s, as I've said, protection is very important, cleansing is very important, and hydration. Or usually for 20s, they have acne problems. So usually a cleanser, a toner, and a sunscreen is enough. If they have extra budget, I would suggest them to use vitamin C. Vitamin C is very versatile. So it's an antioxidant, it has protective property, it also has anti-aging and brightening properties. Do you use vitamin C?
Yeah?
Vitamin C serum?
No. Oral.
Well, it's a good for a starter, pero maganda
Yeah.
may serum ka rin. Vitamin
Okay.
C serum.
Yeah. Okay.
Bibigyan kita. Bibigyan kita vitamin C
Sige,
serum.
mamaya. Thank you. Ano yung mga online treatments, mga fads about skincare na you're against? Yung pang mga nakita mo sa TikTok na skincare routine na kala nung iba maganda, but for a derma perspective, it's a big no. Meron ba?
Well, actually, hindi ako masyadong nagti-TikTok, so hindi ko alam yung mga skincare fads. Pero, over-exfoliating, I think, it's bad for your skin. Pag sinabing over-exfoliating, like using a lot of physical scrubs or harmful scrubs. So, it's not nice kasi you deplete the natural oil of the skin, tapos you expose your skin to more stress. So, mas magiging prone siya to irritation and infection. So over-exfoliating is one of the things that I don't agree. What else? Ano pa ba yung mga fads sa TikTok? Hindi ako nagti-TikTok eh. Ano ba yung mga nakikita mo?
Iba kasi yun nasa FYP ko eh.
Ano yung FYP?
Yung, hindi madami FYP. Yun yung algorithm, yung mga lumalabas sa feed mo.
Millennial ka, di ba?
Yeah, yung sa lumalabas kasi mga about business, about real estate, ganyan.
What else? I think I tell my patients, marami silang misconception about Botox per se. Parang takot na takot sila to do Botox kasi it will make you look frozen, na parang walang emotion.
3 things people should avoid doing to protect their skin. Ano yung mga everyday na ginagawa ng mga nakikita mo na tao na they should avoid doing to help them protect their skin?
Well, shy away from sun. Number 1. Well, minsan pag hindi natin, wala tayong choice but to be under the sun, of course, you wear sunscreen.
So yung mga sunbathing.
What? That's bad.
Really?
Yeah,
Mga
actually.
nagpapatan?
Kasi nga, UVA, it really causes a lot of damage to your skin. But if you deprive vitamin D, okay lang. Pero kasi may certain window lang yan eh. Like 8 a.m. to 10 a.m., yun lang yung healthy rays. And then 10 to 4, that's bad already. So minsan pa nga sasabihin 5 eh. Depende where you are actually. Here sa Philippines, 4 hanggang 4 o'clock lang yung 10 to 4 is harmful rays na. And then beyond that, medyo okay na if you're depleted with vitamin D. Pero generally, if you want to maintain or if you want to protect your skin from damage, just shy away from UV exposure and sun. And always, take care of your body. Kasi nga, it reflects on your skin.
Is it okay to use your girlfriend's skincare products? Yung sa mga magjowa.
My girlfriend? Or your girlfriend?
My girlfriend. Kaya guy ako, di ba? I'm a guy.
Okay.
Tapos, I'm not really into skincare. Nakikita ko sa girlfriend ko, uy, parang gusto ko try yan kasi nakaka-acne ako, nakaka-pimple ako.
Well, of course naman, pwede. As long as okay sa'yo, it suits your skin's need then. For example, you're both oily, pwede mong gamitin. Pero for example, magkaiba kayo ng skin type, parang it would not be suitable for you to use your girlfriend's skincare. Pwede namang you would consult a professional first, hingi ka ng advice on what to use. Kasi nga, merong mga products that would be best for you, especially pagdating sa ingredients, especially pagdating sa texture, that would really address or would really best for your skin type.
Very good. Doc Sheena, any advice to young or aspiring dermas? You know, they're just studying or nagsisimula pa lang sa career. What would be the best advice you could give them?
Well, kahit naman hindi sa mga derma, Anybody who aspires to be a doctor or who dreams of something, as I've said a while ago, we may have a lot of humps, 'di ba? Meron tayong mga different reroutes, but we should not change our goal. If we have a goal, let's stick to the goal. Always eyes on the prize, and never let setbacks stop you from reaching your dreams, guys. Um, if you fail, make sure to stand up again. Always remember the lessons from those failure and keep pursuing your dreams. Hindi ibig sabihin babae ka, wala kang chance to be successful, or hindi ibig sabihin nagkamali ka or you stumbled early in life, wala ka ng chance to reach for your dreams. Ang advice ko lang is always be humble, stay grounded, and always lift everything to God. Pray for everything. Pray for wisdom, courage, and strength in everything that you do.
Very nice. Any message, advice to people who are struggling with their skincare, with their skin, people who face depression, yung self-confidence nila mababa na because of maybe acne or any skin condition, what would be the message you want to give them?
I think my best message is there's no right time to start taking care of yourself. Even if early, even if late, it's always the right time. If you realize that you need to take care of yourself, start now. Wag na natin i-delay. So there will always be room for growth, for improvement, and just be patient in everything. For example, in your skincare, in your treatments, just be patient and make sure to love yourself. To appreciate yourself. Kasi I think doon nagsisimula yun. If you love yourself, if you appreciate yourself, you feel good about yourself. Hindi naman ibig sabihin you take care of yourself, may self-love ka, self-care ka, you're selfish. I think if you love yourself, you're just empowering yourself to take care of a lot of people, a lot of other people then.
Good. Last na, what is the best advice you received during your journey as a doctor, as a derma, and just, in your life?
My best advice would be from my mom. Lagi niya sinasabi sa akin that people maybe may not treat you right. But always remember, there's always goodness in all the people. So let's not look at their bad side. Let's always look at their good side. And let's give chances to others. We learn to forgive. We learn to love without holding back. Because
Wow.
life is short.
That's very beautiful. Thank you, Mommy.
Yes. Thank you also, Zach, for the wonderful afternoon and for gracing us again with your presence here. Zach of Australia.
Zach in Australia.
Zach in Australia.
Zach Alvis na. Wala na in Australia.
Wala na ba?
We're going
Zach
global.
Alves na. Yes,
Global,
that's
yeah.
nice.
Diba? Doc Sheena, thank you again for being on the show. Appreciate your time. And I'm ready for whatever treatment you're gonna do to me.
Yes. So, this is a challenge kasi nga, meron daw siyang shoot tomorrow. So, I have to think of treatments na walang downtime for Zach, na ready siya for shoot tomorrow. So, those are the things that we consider when doing treatments, especially yung mga people that they don't like downtime anymore.
All right, so challenge accepted.
Yes, of course.
Challenge accepted. Thanks,
Let's
Doc.
do bro talks. Abangan.
See you guys.
Thank you.